Hello. Welcome to another conversation with Swallow the Pill. My name is Zena and I am your friendly nurse educator. And today we are going to have a conversation concerning heart failure, or better known as congestive heart failure. Let's talk about it. What is it? How does it affect you? What are some signs and symptoms, and what can you do to get through the symptoms that you are having? Before we get started, I do want to thank you for watching my channel or following me, or even just listening to me. Before you go further, I do ask that you please like, comment, and subscribe. That way it builds support for the channel and it allows me to grow as your nurse educator. So thank you for your support. All right, so let's talk about it. Heart failure, congestive heart failure. What is it? So think about it this way. I want to give you some easy ways to understand it. First, easiest way I can think of is the heart is compromised. Your heart is compromised. It is not completely functioning as it should. Another way to think about it, your heart is weak. Your heart is not as strong as it was 10 years ago. Your heart is not as strong as it was 20 years ago. Another way to think about it, the heart, think about the heart as a pump. The heart is the pump that is responsible for providing and moving blood to the rest of your body, to the rest of your organs in your body, to the rest of the tissues in your body. That pump is now compromised to the point of where it's not able to adequately provide blood to the rest of your body, to the rest of your organs, to the rest of the tissues in your body. The pump is broken. Think about it as a broken pump. Another way to think about it, your heart no longer has the ability to move blood forward, which is what the heart's sole responsibility is, to move blood forward, to supply the rest of your body with the right amount of blood, which is then providing oxygen. So heart failure, basically, your heart is not moving blood forward. So think about it. If blood is not moving forward, where is it going? It's just staying there. So now you have a problem with the filling portion of your heart. And if your heart is just backing up, then there's also a problem with the squeeze of your heart, or the contractility of your heart, which is the mechanism which moves blood forward. So your heart is no longer adequately doing that. Now, understanding that your heart is now compromised to the point of where it cannot adequately do its job. It cannot show up 100%. Now, if you've been told that you have heart failure, now there are some forms of heart failure that can be completely reversible with diet and exercise, drugs, and the right lifestyle changes. You can reverse heart failure. Now, there are some forms of heart failure that is lifelong and it is progressive, and there's literally nothing that you can do about it regardless of what you do. But it's all about paying attention to what your body is telling you and what your doctors is telling you as well. There are a number of ways that your doctor can diagnose heart failure. The biggest one, echocardiogram. An echo. It is essentially an ultrasound of your heart. From that echo, you will get a number. That number is called your ejection fraction. It is in a percentage. Normal ejection fraction, or normal EF, is 50 to 70%. That kind of tells you your heart is within a normal functioning area. I would prefer 65%. If you told me my EF or my ejection fraction was 65%, my heart is normal. My heart is working as it should. Anything below 50%, your heart is compromised. There is a problem somewhere that you need to address sooner rather than later, because if you ignore it and you don't address it, then things will progressively get worse. But an echocardiogram is basically an ultrasound of your heart. It's non-invasive. You could go into the office, your doctor's office, and they can do it. They can also do this within the hospital as well. And they give that report, and that will tell you just how well your heart is functioning. You can also have a cardiac MRI. That can tell you about your ejection fraction. You can also have a CT scan of your heart. And you can also have an x-ray, but an x-ray is not going to give you an EF or an ejection fraction of your heart. So there are a number of tests that you can have that will help your doctors to diagnose the true diagnoses of heart failure. Now, there are some signs and symptoms that you as the patient may notice when it comes to heart failure. Some of those symptoms include shortness of breath, just being very short of breath, especially with activity, not being able to move from point A to B without being short of breath. Swelling, you see swelling in your limbs, just in your feet, in your ankles, in your hands. Your body is just puffy. That is a true sign of heart failure. Rapid weight gain. Say, for instance, you've gained 5 pounds in 2 days. That is another sign and symptom of heart failure. So pay attention. If suddenly you start putting on weight, you gain 30 pounds in 10 days, that is a good sign that you are in heart failure, because your body is not moving blood forward, so things are backing up. So that fluid has nowhere to go because it's essentially not moving. In addition to that, a cough with wheezing. If you are wheezing, that is a telltale sign that there is fluid on your lungs. Wheezing, there is fluid somewhere in your lungs that you should probably pay attention to. And then fatigue, getting very tired really easily and just being always tired. These are true signs of heart failure, and I'm going to advise that if you are experiencing any of these signs and symptoms currently, you need to make an appointment with your doctor ASAP and let them know that you're having these signs and symptoms. That way that they can adequately check you out and get you the right diagnosis with the right treatment. Speaking of treatment for heart failure, there are a number of things that the doctors can do to help to treat heart failure. Now, as I stated previously, heart failure can be reversible. Some forms of heart failure can be reversible. And there's different treatments. Sometimes doctors may put you on blood pressure medicines to regulate your blood pressure. If you watch my previous videos, we've talked about what blood pressure or high blood pressure does to your heart. They may also put you on medications to regulate your heart rate, because sometimes if your heart rate is going too fast, it's forcing your heart to overwork itself. So to regulate your heart rate and to help your heart to recompensate, they will put you on medications that can help to slow down your heart rate. You can also go and have a pacemaker or an ICD implanted. That helps to support your heart when it comes to adequately regulating arrhythmias, life-threatening arrhythmias. It can also help your heart to pump effectively because it forces your heart to beat at a certain rate. So if your heart is not pumping effectively, you can have a pacemaker put in, and it can help your heart to work how it's supposed to work. Now, there are the progressive lifelong things that is associated to heart failure. Now, the reversible, yes. Progressive and lifelong, it is also a yes. Now, if the heart failure is severe enough, then that can lead to you having to have cardiac surgery. Cardiac surgery includes bypass surgery. You can also have a valve repair surgery. And it can also lead to you needing a heart transplant if the heart failure is severe enough. And I have seen patients whose heart failure is severe enough to where they've needed a heart transplant. So when thinking about heart failure, there is the reversible treatment, and then there is the progressive lifelong form. But there is treatments for heart failure. Because heart failure can lead to fluid overload, the biggest suggestion that I would give to patients is to be mindful of how much you're taking in. Instead of grabbing the big 1-liter bottles, grab a smaller cup. And that will force you to take in less fluid, because oftentimes I have seen patients that are heart failure patients be on what we know as fluid restrictions. And that what a fluid restriction would be is, say for instance, over a 24-hour time frame, you can only have 1 liter of volume. A liter is this. This is how much you could have in a 24-hour time frame. So oftentimes patients have a hard time with that, which is why I'm suggesting, instead of grabbing a big bottle, just grab a smaller cup. Now, your doctor will advise you if they want you to be on a fluid restriction. I am in no way saying heart failure fluid restriction. Your doctor will advise you of that. But if they do advise you of that, this is what I want you to be mindful of. You see the difference? Don't grab this when you should be grabbing this, because taking in too much volume, too much fluid, it is only going to add more stress to your heart. So we've talked about heart failure. I've given you an understanding of what heart failure is. We've talked about the signs and symptoms of heart failure, and we have talked about the treatments for the different forms of heart failure. I hope this helps you. And if you are struggling from heart failure of any kind, please, please, please reach out to your doctor. Please allow your doctor to properly treat you. And don't leave any of the signs and symptoms unnoticed. If you are experiencing any of them, please, please, please let your doctor know ASAP. And as always, thank you for following Swallow the Pill, and thank you for listening to me as a nurse educator. I hope this helps you. Please be well.